Hello, everyone. Thank you for joining us for this webinar on mid-back and rib pain. Many people come into our clinic that have mid-back and rib pain, and today we're going to go over what causes that, what treatments are successful for it, and what you can do to help yourself. If you have any questions, feel free to type them in the chat window below. I'd be happy to answer those during the webinar or towards the end. And if you're in the Kelowna area and you have rib pain or mid-back pain or know somebody who does, please let them know about this webinar. We're going to record it. We'll have it up on our YouTube channel as well as on our podcast channel, which is with Anchor. It'll be on Spotify and Apple podcasts as well. So let's talk about mid-back pain and rib pain. My name is Dr. Cary Yurkiw, and I'm a chiropractor who's practiced for over 26 years. I saw a chiropractor when I was young, and it really made a difference. It helped me with knee pain that was holding me back from playing sports at a higher level. And at that time in my life, when I was a young teenager, sports was a big deal. I wanted to play soccer at a higher level with my friends on the playground. I wanted to play hockey at a higher level. I had that desire and the skills, but I had a knee condition that was really holding me back. So my father took me to a chiropractor. He really helped me with my knee condition and did treatment for it, and my knees healed, and I was able to play at a higher level as the years went on. I'm located in Kelowna, so I have a practice in Kelowna, which is in the Okanagan area in British Columbia, Canada. Mid-back pain is classified as the pain running from the lower part of the neck to the upper part of the low back. So it's 12 vertebrae that composes of the mid-back, and it's the curve that goes outward in your spine. So it's that kyphosis, we call it, the curve that goes outward, that we're going to talk about today. Just a disclaimer, you should consult with your health professional about your specific condition. So I'm going to share with you patients that I've seen in the clinic and what I've done for them to help them, and how I approach mid-back pain. But if you have mid-back pain and rib pain, you should go and see a doctor and get some advice. So make sure you see your health professional. If you're in the Kelowna area, you can always come in to the clinic, and I'd be happy to assess you and to help you with your mid-back and rib pain. The anatomy and the physiology of the mid-back, there's 12 vertebrae in the middle part of the spine. And in between these vertebrae, there's discs. So discs are like jelly donuts that are like shock absorbers in between the bones, but allow you to bend and twist and move. There's joints between those bones, and these joints, there's two of them in the back part of the spine, and these are called facets. And in between those bones, there's cartilage over top of the bone, fluid in the middle, and a capsule or ligament that holds that all together. The spine protects the spinal cord, and that allows the nerve flow or the communication to go from the brain down through the spinal cord, and it exits through nerve roots, one set on the right, one set on the left of the spine, going to different body parts, like your organs, the heart, the lungs, the stomach, and also to the muscles, the skin. And so the nerves provide communication, both sensory, the way you feel in that area, motor, to the muscles so you can move and you have power, and then there's reflexes too. There's these autonomic processes that you don't have to think about that are regulating the body, and all that communication is coming from the brain. The main movements of the mid-back are flexion, bending forward, extension, going backward. This can be difficult because sometimes it can pinch the joints when you go backward. It can irritate the facet joints. So extending when you have mid-back pain or rib pain can be very difficult. Twisting and then side bending. Also in the mid part of the spine and related to the mid-back are the organs. And the organs are the lungs, the heart, the stomach, kidneys, the gallbladder, the liver, and the intestines. So we'll talk about that as we go on with our webinar today, but sometimes these organs can refer to the mid-back or vice versa. So what causes mid-back pain? If you overuse or strain the mid-back, maybe you're doing some work and it's in a tight position or you have to really twist your back, it can strain the muscles and the joints, and that can cause mid-back pain after you're done. The ligaments can get stretched, and that can cause mid-back pain. And ligaments are the tissue that connect the bones from vertebrae to vertebrae, but also from the vertebrae to the ribs. There's discs in between the bones that can cause pain because the discs are shock absorbers, but they also have a certain height or volume to them that allow the nerve roots to come out on either side of the spine. So if these discs are getting compressed, it can start to close in on the nerve root coming out of the spine. The nerves can cause pain. An irritated nerve, there's different symptoms, but it can radiate around the ribs and into the front of your body and cause referred pain. Joints and inflammation of joints, like arthritis, can cause pain in the mid part of your spine and the ribs. And then there's other conditions that can cause mid-back and rib pain. So we'll go over that today as well. As far as the ribs go, there's 12 sets of ribs, which correspond to the 12 vertebrae in the mid part of your spine called the thoracic spine. So there's 12 ribs on the right and 12 ribs on the left that connect into that thoracic area. And we number them top down, 1, 2, 3, 4, all the way to 12. And that corresponds with the segment numbers, thoracic number 1, T1, going all the way down T5, T6 to T12. The ribs join onto the spine. The upper ribs are fixed. They have an articulation on the spine as well as they join onto the sternum or the breastbone in the front. The lower ribs, some of them are floating, so they don't attach onto the sternum in the front, but rather they're more flexible. So what can relieve mid-back pain? If you're suffering from a nerve that's irritated, joints, muscles, what can be done about it? And in the clinic, the first thing for me is to do a diagnosis to find out more about what's causing it and then do the right treatment. The treatment can involve an adjustment, it can involve stretching, ice, heat, or rest. So these are some of the things that we like to review and start care with in the clinic. And we're going to go over these items on the slides coming up. How do you know if your back pain is muscular? Well, movement. If movement causes pain in the back and in the muscles, there's a good chance that the pain is coming from a muscle. So if you're moving and it's increasing the pain and there's some pain radiation along the muscle group or the muscles are cramping, there's a good chance the pain is muscular. If you're having trouble just holding your back up, being in a certain position when you're upright or standing, there's a good chance there's muscular involvement in the mid-back pain. I don't recommend cracking your own back. And I know patients have come in that have tried to crack their own back to get rid of the pain. They know maybe they've had it before and a chiropractor's worked on it and it's relieved the pain. I don't recommend doing that yourself because it can make it worse. If the joints are already sprained or strained, um, putting force on those joints, and if you do it incorrectly, it can make it even worse. It can increase the inflammation, it can irritate the nerves, and then it gets harder and harder to even move or breathe. So people have come in and they just basically can hardly even take a breath in. It's just too painful, or move because their back is just locking up on them. So don't crack your own back. Go to see a chiropractor and be properly assessed for it. Is the back pain serious or urgent? Sometimes I'll get a question or a phone call, and what should I do? It's excruciating pain. Um, I think if you have some of these symptoms, it is urgent, and you should go to a healthcare professional immediately. So if you have persistent fever, you've had weight loss in the recent days and months, you have blood in your urine or stool, numb or weak legs, can't go to the bathroom, can't start or stop, you've lost the control of your bowel or bladder, you have pain at night, or you're running a fever, those are good reasons to seek immediate attention. So if you have those, you might want to go to the hospital, contact your doctor, and get in to get assessed right away, because those could be indications that the mid back and rib pain is serious and needs immediate attention. Patients will ask me, should I use ice or heat? So if your injury, or if the symptoms just came on, so they're acute, meaning it just started, using ice I find is better. So putting some ice or an ice pack, wrap it up in a towel, apply it directly to the area for about 10 to 12 minutes. That'll reduce the swelling. So that generally makes people feel better. They feel a little stiffer after that because of the cold, but it reduces the swelling, reduces the pain generally. And if you can do that 3 to 5 times, giving it a rest of at least 15 minutes in between, that will help to reduce the inflammation and reduce your pain. If it's been there for more than a few days and you've been struggling with it, again, um, seek medical attention, but sometimes heat will work better in that circumstance. So the inflammation has increased and it's at its peak. It's done its job to try to help repair that area. And now putting heat on it can increase your metabolism. It can soften the tissue, and it can just make it a little easier when you do come into the clinic to work with that area. It could be easier to adjust or to stretch that area to make it to accelerate the healing process. Some people, just heat works better. Again, a moist towel in this case, and a hot water bottle or something like moist heat. Apply it directly to the area. Do that for 10 to 12 minutes, and do that for 3 to 5 times, giving it a break of about 15 minutes in between. That's a good way to soften that tissue and speed up the metabolism with the heat. Sometimes, for some patients, using heat and ice works better. So there's a bit of an effect where you put the heat on, it expands the inflammation in the tissue, then the ice contracts it, and it works a little bit more like a pump, where the heat and the ice are getting applied one after the other, and then the area is given a rest. So that can work well for certain people, but generally when the condition is not so acute, but it becomes more subacute, that's when I'll talk to patients about using ice and heat combined, or just using heat. Back stretching is good, but don't do it initially. So if you have a problem in the mid back and your ribs are not working right and you have pain, don't stretch your back. It's not a good idea to do that when there's an acute problem. So get that assessed and then get some treatment for it by a healthcare provider. And as the pain starts to get reduced, the healthcare provider will give you some stretches or exercises to do to help relieve the pain, increase the range of motion, and restore the function back to the area. So I like to prescribe stretches after a few days into care. Maybe we've had 2, 3, 4 treatments, and now it's time for the patient to get involved, and I can monitor their progress. So we can do that by giving the patient some stretches to do at home. We use telehealth now, so we can follow up with the patient using a secure platform to see how they're doing their stretches or exercises. And then when they come into the clinic for the next treatment, we can review the stretches with them. If the patient has any concerns, we can address those. So I like to add stretches into the routine after a few visits. How do I assess mid-back pain? Well, we do a history in the clinic, so we want to understand exactly what caused it, if you've had it before, what could have been the factors that um, led up to it, what's making it worse or what's making it better. So we really want to understand the history of the complaint, but also the general history of the patient as well, because there could be some other factors that play a part in the mid-back pain, and um, the patient may not think that it's related. So we want to do a full and thorough history, and then a full examination to find out what the ranges of motion are like, what the alignment's like. We'll do some testing to find out what the cause of the pain is, and then we'll make a diagnosis. And the diagnosis is basically what's causing the back pain. And then we always have differential diagnosis. What else could it be? So as a healthcare provider, we have our diagnosis and differential diagnosis. And then we start treatment. And in a chiropractic clinic, the treatment is done hands-on. So it can be done with adjustments to the spine, adjustments to the ribs. There's different ways to adjust that area to restore the alignment and the function. We also do some stretching with the patient. We'll apply heat or ice in the clinic, and then we'll advise the patient on what to do when they get home as far as some lifestyle modifications. So the treatment will be hands-on, and sometimes we use instruments as well. We'll use an instrument to move the ribs or move the spine. I like to use something called an activator. I find using the activator on the ribs can be really helpful because it's very specific, that adjustment using that instrument, and using it right on the rib can be very helpful. The patients like it because it's gentle and it's comfortable for them. So hands-on and instrument adjustments. Sometimes we use tables. We have special tables that can pop up and down to help us make adjustments. And for the mid-back, we always assess the spine. We assess the ribs as well. And sometimes there's a combination of both. We need to adjust the spine and the ribs in order to relieve the pressure on that area. How long does a visit last? Well, and how long does rib pain last? It can last for, rib pain can last for days to weeks. So if you do have rib pain, expect it to last for days and hopefully not weeks. Once you get active with treatment, the pain starts to get reduced. So when the treatments start and the adjustments are done, the pain starts to decrease, and that shortens the healing cycle. We'll give the patient recommendations, and I find if the patients follow those recommendations, it reduces the duration of the rib and the back pain. We'll follow up closely at the beginning maybe every day or every other day, so that the patient heals as quickly as possible, and that we're staying on top of their condition and giving them a good advice at home. And our goal is always to uh, transfer the care to the patient, give them more responsibility as time goes on to help heal their back and to keep the back in good shape so it doesn't um, go back out of alignment or recreate the same problem again. If you have mid back pain or rib pain, you have joint pain, call our office to book an appointment. We are taking new patients. So our phone number is 250-486-0062. And again, we're in the Kelowna area in the Okanagan in British Columbia. I did write a book on back pain. And so if you're interested in reading about uh, my approach to back pain, the book called Back Pain is on Amazon, and it's in ebook format, a Kindle format, so you can read it there. You can read it in paperback, and then there's audio version on Audible. So it took a long time to write that book. It was a great experience. I always wanted to write a book, and it did take over a year to write the book, but finally it got published. It is on Amazon, and you can just type in back pain and my name, Cary Yurkiw, and you will be able to find it. We have webinars coming up, so we do quite a few webinars in a webinar series. We try to cover the most common topics that we see in the clinic or what patients ask for. So um, I've done some webinars on book reading from the back pain book and my neck pain book on Amazon. We've done webinars on joint pain, arthritis, on lifestyle changes. So all of these webinars are on our Eventbrite page. So if you go to Eventbrite and then you type in Yurkiw Chiropractic, you're going to see the upcoming webinars that we have in the next few weeks. If you've missed a webinar and you want to see the webinar, we have recorded it and we do put it up on YouTube. We also have an audio format, and that's on Anchor, which gets distributed to Spotify and Apple Podcasts, places like that. So you should be able to reach it if you Google podcast Dr. Cary Yurkiw. You'll be able to find that. And of course, if you go to Google, our channel is Dr. Cary Yurkiw, and then you'll be able to find that specific webinar, like this one on mid-back and rib pain. Here's my contact info. So we're at 105-1628 Dixon Avenue in Kelowna. The phone number is 250-486-0062. And my email address, drcaryyurkiw@gmail.com. And if you have any questions, feel free to send me an email or give us a call. I want to thank you for joining our webinar today on mid-back and rib pain. I hope you learned something as far as the causes and our approach to it. And if you do have mid-back pain or rib pain, know somebody who does. Do get that checked immediately. See what the cause of it is, and then get the appropriate treatment so that it restores the alignment and the function of the spine and the ribs, and prevents reoccurrences. So the healthcare provider will give you some recommendations on what you can do to prevent reoccurrence of it. It can be quite painful, so doing the treatment to help someone is a great thing. It makes them feel a lot better in a fairly short period of time. So again, consult your health professional, and I hope you guys can join us for the next webinar coming up next week. Thanks, and have a wonderful day.